Well, hello, Melissa. Thank you so much for joining us today.
Thanks for having me, Cindy and Kathy. It's really good to see both of you again.
It's wonderful to see you. Kathy and I have had the tremendous fortune to work with Melissa. To our viewers, we worked in academia as professors many years ago, and we are very fortunate to have kept in touch with Melissa, who is a therapist, a private practice owner, and a brain spotter. And so, Melissa, why don't I hand it over to you and you can kind of provide a little introduction of yourself?
Sure. So, just to be really short, my name is Melissa Wesner. I am a certified brain spotter and I'm a brain spotting consultant. And I'm the founder of Lifespring Counseling Services. We are an insurance friendly group counseling practice here in Maryland.
That's wonderful. Thank you for that intro. I know that it's probably piquing people's interest. What is brain spotting? And we are certainly going to get to that in a moment. Before we jump into brain spotting, can you tell us a little, Melissa, just about your story in terms of what drew you to the field of counseling and therapy to begin with?
Yeah, I wish I had a cool story. I don't necessarily. So, I actually have an undergraduate degree in Christian ministry. And when I graduated with that degree, a lot of when I started looking for jobs, so when I was looking for international work, and I was like, a lot of these programs want me to be a volunteer and like fundraise my own money. Like that's not really going to be sustainable for my life. Um, and and then also because I had a Christian ministry degree, a lot of people were like, so did you want to become a pastor? Did you want to work in a church? I'm like, no, that's not really what I wanted to do. So I ended up taking off a year from school and I did a year with AmeriCorps to figure out what in the world am I gonna do with my life. And I started searching and I was considering nursing. And I remembered that I took some family studies classes, interestingly enough, since we all worked in a family studies department. And I realized that those are courses that I really enjoyed. So I had to say to myself, like, would you be more likely to enjoy a nursing program or a counseling program? And I decided to go with the counseling program. And so that's really how I got in. Some people have a really cool story. There's a therapist who really changed my life, and I wanted to be like them when I grew up. I was a person who knew that I wanted to help people and I was trying to figure out what to do with my life. Unfortunately, by the time I ended up pursuing a counseling degree, I feel like I got lucky that that landed and that stuck and that felt really aligned. But, that is also sometimes how life goes. You're trying to figure out what is the best fit for me. It's not maybe the coolest of stories, but it's a real story.
I actually think it's a really cool story because, as you mentioned, kind of at that foundation, you wanted to help and you weren't quite sure what direction you might go down. You were contemplating a couple things, nursing, counseling, and even at the helm of your experience was volunteer work, which that to me is really admirable and that usually attracts helpers. And so I think kind of being a helper and helpfulness is a really great starting point to your story.
Yep. So that's how I landed here.
So you kind of identified that helper quality, you landed in counseling. Kind of take us from there in terms of how your path kind of wound down the road in terms of I know you had a pit stop in academia, you became a practice owner.
Yeah, so I guess the story kind of continues along similar lines where I'm just pretty much trying to figure out life. So I went to school and I did my graduate program. I was actually going to do my internship working in a jail. They were going to pay me for my internship, which sounded wonderful. Only I got there and it was an absolute mess and they were not paying me, which then resulted in me needing to look for a job. And it was at that point that I applied to a role working in a methadone facility. Didn't know what methadone was, but I went on the interview. I did the thing that you should not do, which is go to the interview without researching the job or I don't know what methadone is since that's what you're applying for, but that is exactly what I did. And for some reason, these people hired me because they were like, "Have you ever heard of methadone?" Nope, but I am here interviewing for this job where you give this medicine that I know nothing about and haven't even done my homework on. But they hired me nonetheless, and I worked there for 7 years. I was in school during that time. I stayed in that role. And again, I felt really lucky because I didn't know what I was doing. I was like, I'm just trying to figure out life. I need a job. This sounds interesting. And I feel like I got really lucky in that I did really enjoy working with clients with substance use disorders. So I did that work for 7 years. I know sometimes now people don't really stay in roles for 7 years, but I really enjoyed the work working in the city, working with clients. And then there was a point where there was no other place for me to grow in that organization. So I started looking elsewhere, which led me to meeting both of you at the university and teaching. And I gotta say, I had a lot of guilt. And that was a struggle accepting that position. I felt a lot of guilt for abandoning the work, so to speak, and leaving my clients. Like I went to school for this, and now I'm going to go take on this other role where I'm not doing that work. So that kind of felt like a little bit of a struggle. And as you know, I stayed teaching for 2 years, very different role, but also I was aware that where my heart is doing clinical work and that I needed to go back to working with clients. So by the time I made that decision, um, I knew that I wanted to work with clients again, but I also knew that I didn't want to be at an organization where maybe I didn't agree with all of the decisions. I wanted to provide quality care. And I also wanted to be in charge of my decision making and felt like I could make some pretty good decisions. And so that led me to opening up my own practice. I had some friends, also friends that I met when I worked in drug and alcohol treatment. We were meeting for a potluck and we were like, why don't we just open up all of our practices? And so each of us opened up our own practice. We shared office space together. And that is really how I ended up getting into private practice work. But really, it was just realizing that this is where I needed to be. I needed to be back to working with clients.
Mhm. I love that story. Just to kind of circle back to the opening where you talked about how you weren't quite sure what the field involved when you started working at the methadone clinic and with individuals who were navigating addiction. What's interesting to me is I wonder if the interviewers were able to see past that to that helpfulness and that passion that you carry with you, and that really drew them to wanting to bring you on board. Um, I also love kind of hearing about the sidestep into academia. Kathy, you probably remember when we worked with Melissa, I loved how passionate and how helpful you were. I know you were always brainstorming ideas to engage students more and to really kind of get them invested in their education. And so seeing that passion, even though it was 2 years and it wasn't as lengthy as some of your other experiences, Kathy, do you remember that just how the ideas and the care that Melissa brought to the classroom?
I do, and I remember that great energy. We actually were team teachers together, so
Hmm.
we were in the classroom together quite a bit, and I love how you reflect on taking that pause. You were working in academia and you were doing purposeful work, and it gave you space to think about what you really wanted and how to align your goals with your values, with your passion.
Yeah, and one day if we ever want to do a comedy version, we can tell the funny stories of some of our interactions and meeting one another.
Yes.
That would be great. Yeah, let's book that, and, we'll convert it into, a stand-up show. But yeah, it's interesting also as you talk about, kind of going into different fields, and even though that goodness of fit might not have been there, you still carried with you, that the desire to make an impact in people. And, I was really appreciative when you told me you were going back to clinical work, because that took a lot of, I think, courage and a lot of insight and self-awareness to make that shift back to clinical work. And I love just hearing kind of how it stemmed out of a collaboration with your former coworkers and your desire to really be able to manifest that vision that you have and that I always really valued in you.
Yeah, well, and just to also clarify, it didn't necessarily feel like good for you for making that choice, right? Because even though I knew that clinical work was where I needed to be, it's where my heart is, it's what I enjoy, it's aligned for me. It's still kind of it feels a certain way when something doesn't work out for you the way that you want to, right? Like in our department, there's a lot of people who are like, I've been doing this for years. This is what I want to do. And so, also grappling with feelings of like this didn't work out or it didn't fit the way that I wanted it to fit. What does it say about me that I'm leaving after 2 years, right? As opposed to celebrating, like, yes, we're getting back to doing what you love. There's also the feelings that come with making a transition.
Well,
Yeah, that's such a good point. Kathy, go ahead.
I was just thinking it really is your mindset because you could look at it both ways. You could look at like, why didn't this work? Why didn't I fit? What's not working or what can work? What is the possibility? What is the greater drive here?
Yeah. And I often think about that quote. What is it? I think it's attributed to Einstein. Maybe it's not really him who said it about like you can spend your, like a fish can spend its whole life trying to climb a tree and think it's stupid. Right? But, like, if you're in the wrong place trying to do the wrong thing that's not suited for you, it won't feel aligned, and you might feel like it come up short, but it's because you're in the wrong environment, doing the wrong thing for you.
That's right.
Yeah, and I think sometimes when people feel that discomfort about maybe shifting gears and feeling like, oh, I dedicated my time here and I need to kind of hunker down and stick to it. I can understand that, but I also really applaud kind of making that decision. And it sometimes feels like stepping off a cliff into the unknown. And I think it just takes a lot of bravery. And I know I was really um, just admiring your shifting gears and your pivoting like that. And so it was something that I always really appreciated about you, and I still do.
And I think when we think about bravery and kind of taking initiative, thinking about new ways to take care of our mental health, brain spotting is an option that's out there and it's different. It's might be something you haven't heard about, but it's actually been around for a long time. And how sometimes you have to think about trying different things or thinking differently to get where you want to be.
Yeah. Now, Melissa, on that note, tell us how you encountered brain spotting for the first time. So you're a clinician, you're working in a group practice. Um, at what point was brain spotting kind of introduced to you, or how did you encounter it for the first time?
Yeah. So I was looking for an approach to helping people process trauma. So I feel like I had really good solid foundation in terms of providing clients with education about trauma and helping them with things like sleep hygiene or understanding their traumatic responses. But I also feel like I needed a modality to help them process the trauma itself without just talking about what happened, regurgitating what happened. You don't want people having to constantly explain some terrible event that happened. I pursued EMDR training and that was fine. EMDR is very popular. A lot of people really like it, find it very helpful. For me as a clinician doing EMDR, it felt maybe a little rigid, a lot of memorizing. I found myself having to focus on my notebook rather than really connecting with my client. And so talking with one of my colleagues for coffee one time, and we were like, well, we should go and do a training together. And we were both maybe reading about brain spotting. We decided, let's go to this training together, did the training. And once I came back from doing the training, I got to start utilizing it with my clients. And the things that I started noticing with my clients in session were things that would never come up in a talk therapy section. And so, really seeing the results from my clients in session is what sold me on brain spotting. And I drank the Kool-Aid because I'm now a certified brain spotter. I'm a brain spotting consultant. I help other people get certified. So it's just a really unique modality that can be really helpful for people, not just with trauma, but other difficult experiences, difficult emotions.
Yeah. You know, I really like your point about how with trauma, it can feel sometimes re-traumatizing for people to continue to tell their story verbally. And so there's a need to process and to move forward in a productive way. But talk therapy is very effective, but it's not necessarily a modality that connects with everybody, and it doesn't connect with, you know, everybody all the time. And so I love that there's options for processing trauma. And I also really like kind of that exploratory spirit that we were talking about earlier in terms of you exploring different jobs. And here, you felt like EMDR necessarily wasn't a good fit for you. So you wanted to explore more and look into other opportunities like brain spotting.
Yeah. And that is a nice thing about having your own practice is then if you're curious and interested in something, you are the one who can authorize moving forward with it.
Yeah, that's interesting. So, you mentioned with EMDR, it sounds like you knew immediately that it wasn't necessarily something that you were drawn to. And then what was after you did your brain spotting training, what was your immediate response after that?
Yeah. Well, and I guess just to go back a little bit. So when you do training for EMDR and brain spotting, both of them, so you have to practice using the modality. You're practicing on other therapists as the facilitator, but you also have to be the client in the trainings for EMDR and brain spotting. So even in being the client with EMDR, there were just some elements of the EMDR setup that did not like the protocol that just wasn't resonating with the issue that I was working on, right? So with EMDR, they ask, well, what is the negative cognition you're experiencing about this? What is the positive cognition you want to believe? Well, I was processing a loss, a death. I don't have a negative belief about myself. I'm just really sad that this person died. So, like, having to identify a negative cognition and then a positive one didn't feel aligned. And then even in being the client with brain spotting, I'm someone who had a really hard time brain spotting myself. And I work with clients who also sometimes have a hard time getting activated. So it wasn't with brain spotting, it wasn't even my own experience as much as what I witnessed in doing this work with my client.
Hmm. Yeah, I think that's also interesting to understand a certain modality through the lens of both client and counselor. I think that can be really informative. So you mentioned seeing kind of the transformational process in your clients. Can you tell us a little bit about what you saw and what made you really intrigued to move forward to become certified?
Yeah. So with brain spotting, a lot of times, not always, but a lot of times you're working on a difficult experience, a difficult emotion. And what I was finding and still find is that when we were done processing, using brain spotting, a lot of my clients would say, oh, that thing feels smaller now. That thing feels further away now. Or I'm thinking about that thing, but I'm not getting activated. I'm not experiencing the same level of reactivity as before. And so that was just very consistent in terms of my feedback from clients. Um, but also there were just some things that would happen in the brain spotting session, or, I really felt like so interesting. I'm really getting to see what someone's brain is like in here. And especially working with creative clients, sometimes really creative imagery would show up. Sometimes movement would spontaneously occur in sessions. People would remember things they wouldn't normally remember. Via talk therapy, they would make connections, gain new insight. And so those are things that really stood out at me as being different.
Wow. That's Kathy, I'm curious as you're kind of listening to Melissa describe what she saw during session. I'm curious to hear what you think. For me, it sounds kind of as a comparison to EMDR, it sounds like it was a little more open ended. It was more fluid and allowed for kind of creative energy to enter in. It wasn't maybe as protocol driven. Um, and I'm kind of keying into what you said earlier about EMDR feeling more structured. Yeah, sounds very appealing to me. I loved creative energy and creative modalities. Kathy, what do you think as you're kind of considering the clinical space with brain spotting?
It sounds a little less prescriptive per se. I'm not sure because I've never done it or been trained in it, but it sounds like it offers a different way to approach an experience.
And Melissa, I'm curious if you can give maybe the Reader's Digest version of maybe brain spotting before we do a demonstration. In terms of, it's similar to EMDR in terms of using eye, like vision and bilateral stimulation. But can you kind of describe what the differences, similarities, and what somebody could expect with brain spotting?
Yeah. And also, I guess if I can step back for a minute just to talk about some of the similarities in case anyone is familiar with both. So, like you said, EMDR and brain spotting do both use the eyes. With EMDR, you might be following the provider's fingers back and forth or following a light. With brain spotting, we are helping people find most of the time one particular location in their visual field where the information that they're trying to access is stored. So we're finding a specific location in their visual field. But brain spotting and EMDR both make use of bilateral stimulation. With EMDR, you might be using tappers or you're moving your eyes from side to side, so bilateral in that way. With brain spotting, we're using bilateral sounds, and also EMDR can use bilateral sounds as well. So you're getting that bilateral aspect. And the protocol for EMDR and the setup for brain spotting do have some similarities, but there are some like cognitive questions that keep you in your thinking brain that are not covered in brain spotting that I really appreciate. And brain spotting is less structured. So if someone were coming in for a brain spotting session, sometimes we talk about that in advance so they can come prepared. We might plan for when is the best time for them to try their first brain spotting session, making sure that they have some time to breathe after their session, stretch, go for a walk, journal, maybe not jump into a really important meeting right after. Um, but we would come to, if we were planning a brain spotting session, I would say, okay, well, what do you want to work on today? Or maybe we already know because maybe we've already determined that in advance. And you might say, well, I really want to work through this issue that happened over the past week. You can tell me a little bit about it. And then I'm going to follow this little process that we follow to get you started. Make sure that you are activated, feeling it in your body. And then I'm going to guide you through a process to find a location in your visual field where you can best access the information that's stored deeply in your brain and body. When we're doing brain spotting, we are able to tell when someone is on a brain spot because their reflexes start going off. So oftentimes this looks like blink, 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 which we call a cascade of emotions. It could be twitching, sneezing, muscle twitches, other reflexes that show up. For the client, sometimes that they can also feel and tell when they're on a brain spot. They might notice like nausea on a particular spot. They might feel some of their reflexes going off. They might feel an emotion more strongly on a particular location. But once we find that brain spot, we're going to stay on that probably for most of the session. And what happens when someone is on that brain spot, thoughts, feelings, memories, physical sensations naturally start to show up and process. It can sometimes be like a wave, right? Like a wave of intensity, then it comes down, or different memories coming up. And so we ask people to simply notice what is showing up. Notice without judging, notice without questioning, like, that's weird. Why is that coming up? We're not going to question. If something is showing up, it is showing up for a reason. And so that generally is how we conduct a brain spotting session. There's not a lot of talking, which can be great for a number of reasons. When we're not talking, our brain can process more quickly than if you have to like slow it down in order to get the words to come out of your mouth. Um, so your brain can process really quickly in that way. And also for people who have been through difficult circumstances, they don't always want to talk about it. They don't want to talk about it because it's maybe embarrassing. They're ashamed of it, or they just don't like talking about it. They don't actually have to, and they're still going to get the benefit of processing.
That's so interesting. Um, you know, what I think is really intriguing about not the a lack of verbal processing is when you're using more of a somatic method, something that's more visceral. I think there might be a lot of question marks for the person why it's working. Maybe they don't know and they feel compelled to, or they feel stumped at processing kind of the experience verbally. But if you allow it to just kind of carry through as a bodily function, you don't have to feel that pressure of kind of providing that narration.
Yeah, and sometimes people do feel pressured, am I doing it right? Because they've never done it before. Sometimes it's the first time. People oftentimes want to know, am I doing it right? But that am I doing it right can also be reflective of parallels and patterns that exist in our real life of wondering, am I doing it right? Am I doing this right in life? Um, so if are able to take that pressure off and trust that your body knows exactly what to do, you don't have to worry about that. The process will unfold. Your body knows what to do. That can be helpful for people to know as well.
Yeah, that's so interesting. I like that you're really keyed into the parallel process, what's coming up, what they're bringing to the table, maybe verbally as a parallel to maybe an issue that they're navigating in their or in the real world outside of the session.
Yeah.
So I wonder, Kathy, do you have any questions before we maybe segue into a brief demonstration?
No, I'm looking forward to the demonstration.
Me too.
All right, Cindy. Well, I know you volunteered for this, that you are doing this voluntarily. So, what I would suggest for the purpose of our very brief demo that we'll do today, for the sake of making sure that people understand what this looks like, what to expect, I would just ask you to pick something that is only like mildly activating, right? Like
Hmm.
maybe it's like, oh, I feel really on because we're recording right now. Something that's just like really mild for the sake of us only doing this very briefly. Um, and then I'll guide you through the process, which can be really helpful because a lot of times clients will say, I understand the words coming out of your mouth, Melissa. It's not like I don't understand. I understand the words. And also, I still don't get it. And so sometimes people need to see it to understand or to experience it to understand what was just communicated to them because it is very different. It's a very different form of therapy. Um, so you can begin thinking about what that very small thing, because we don't want to like get you activated and then be like, bye, Cindy, I gotta go. Um,
Right.
Something like really mild. But for anybody else who's watching the video, what I do want to invite you to do is to pay attention to Cindy's face, right? And this is one of the things that can be a little bit different for people doing brain spotting because as a therapist, I'm literally staring at your face and you are going to be staring at a pointer or something. And so I'm going to ask everybody to like pay close attention to your face during the demo. You want to be paying attention to reflexes, blinking, sneezing, twitching, changes in breathing, all of those things is what you want to be paying attention to as I'm doing this demo with Cindy.
Wonderful. Can I ask a quick question, Melissa? So I think it's great that there's such a hyper focus on all of those kind of reflexive movements and twitches that might otherwise go unnoticed. Do you recommend the client, or me in this case, Um, am I supposed to be aware of anything?
Your job is simply to notice whatever thoughts, feelings, physical sensations show up.
Okay, perfect. Got it.
Yep. So the rest of us, we're going to be paying close attention to reflexes and things like that. You don't need to pay attention to that. You just need to
Mhm.
pay attention to whatever thoughts, feelings, physical sensations show up.
Okay, perfect.
Okay. So just so we can like very closely mimic what a section would be like, um, I would say, tell me very briefly, and also keeping in mind that people are watching, tell me very briefly what you would like to work on today.
I'd like to work on maybe a slight increase in workload that I'm going through. Just I'm doing some extra research projects and I'm feeling a little bit more spread thin than normal. And so maybe processing that would be what I want to focus on today.
Okay. And as you're talking about that right now and thinking about that, are you feeling activated?
Yeah, I'm feeling kind of the laundry list of the to-do list coming to the forefront of my mind.
Okay. And on a 1 to 10 scale, 10 being the strongest, how strongly are you feeling that?
I would say compared to when we first started talking, I was maybe at a 2. Now it brings me maybe to a 4.
Okay. And where in your body are you noticing that?
I notice it in my stomach starts getting those butterfly sensations when I start thinking about deadlines looming and that sort of thing.
Okay. So you can feel it in your stomach a little bit.
Mhm.
Okay.
Yeah,
Well,
and
what I
maybe
noticed,
maybe
okay.
my heart too.
Okay. I noticed your eyes going up to this spot over here. Did you notice that?
No, I didn't.
Okay. So one, let's just check out that spot over there.
Up
Uh,
this way?
Yep. I don't know if you noticed it. If not, we'll go and we'll find a spot a different way.
Okay. So should I just kind of avert my eye contact
I'm going to
upwards
help
here?
you find that spot.
Okay.
Okay. So I want you to pull up the issue that you're working on.
Mhm. Okay, got
Notice
it.
that sensation in your body.
Mhm.
All right. Are you able to access that right now?
Yes, I can
Yep. Stay
feel
on that
the
spot.
okay.
I saw it.
You
Yep.
did? Okay,
Stay
so
right
look up
there.
here. I do feel kind of heart fluttery and maybe a little flushed.
So notice all of those sensations.
I feel like, I thought that it was in my stomach, but I feel like it's more kind of in my chest region that the pressure and um, even, like, the lungs, like, I feel a little not choking, I mean, that's too dramatic, but I just feel maybe, like, if I were to stay here for a long time, it would be hard to catch my breath, you know?
Notice that feeling in your chest.
I'm also noticing my heartbeat, it seems to be beating faster. I don't know if I'm just more aware of my heartbeats, but it seems to be at a more rapid pace.
Notice that.
There's different thoughts that are coming to my mind in terms of just, um, gosh, what if I disappoint people? What if I feel judged for not doing a good job in what I want to do a good job in? So there's kind of like a little fear of, letting the ball drop.
Notice this thought.
For the first time in the conversation today, or, our conversation now, my mouth feels a little bit more parched than it did, at any point during our conversation so far.
Yep, and be aware of that. And for the sake of time, we're going to take one more minute on this spot. So just take a minute and be on the lookout for a spot that feels like an okay spot to end.
Okay, I think I'm ready to maybe come back. Should I avert my gaze? Should I look back at the screen?
Yep, whenever you're ready, just come back to the room, come back to the screen.
Okay.
All
Oh, I feel
right.
different. It does feel different.
Yes. So if this were a therapy session, you and I would be on that spot for a lot longer to be able to see whatever thoughts, feelings, physical sensations show up. And we would have more time to see the progression. Um, and we do something at the end that we call squeezing the lemon. We go back to the original issue. And when we think about that now, what thoughts, feelings, physical sensations come up? How intense is it now when we go back to that spot? So obviously we're just doing this for a few minutes for the sake of helping people understand what this would look like. Um, and then as we are, at least when I do brain spotting with people, I like to save some time at the end of our session to talk about their experience, what came up for them. I sometimes share my observations, things that I might have noticed during their process. And then we always want to make sure that someone is feeling as grounded as they possibly can after processing. Um, so for you, Cindy, because I know we got you thinking about something that's creating some stress, just inviting you to take a deep breath, grounding your feet on the floor, bringing yourself back to this room, noticing the temperature in the room where you're at.
Wow, that was really interesting. Do you want to hear something I wasn't expecting when I was looking at my spot versus coming back? Um, I felt I don't know how to describe this. I felt kind of when I was looking over here, almost like an aura of redness, not literally, but it felt kind of. And then when I look back at the screen, it felt like a serene blue, like a calming kind of color. And I don't mean literally that I saw different colors, but it felt like I was accessing a different color, if that makes sense.
Yeah. And that's one of the things that I think is so interesting about brain spotting. That's what I mean when it's like seeing someone's brain and how someone's brain works, right? Because you'll have people who like lines come up or colors, or especially with very creative people. And I think of you, Cindy, as someone who's very creative, right? So that makes so much sense for me, right? It's about kind of seeing how people see things and experience things in a different way when you're brain spotting.
Wow. Oh my gosh, I loved that. That was really impactful, Melissa. I know it was just a sample of what somebody can expect a longer duration and more, um, you know, kind of some of those therapeutic properties more intensive, but that really gave me a vivid feeling of what brain spotting could look like. And I thought it should be um, really interesting. And would you suggest to me and or clients, would once they have identified their spot, can they on their own go back to it, or should they reserve that for working with you?
Yes. people can self-spot. Self-spotting is a thing. And also, I would not recommend it, right? So some of the things people are bringing to therapy are like really heavy. And so unless someone has been doing brain spotting for a while with a therapist and they know what they're, you don't want someone brain spotting at home and then they're like bringing up some stuff and being unsupported or getting dysregulated. I would say wait until you've done a lot of work in that area and you're really familiar with brain spotting and how it works, then before trying to do it on your own, is what I would tell people.
Yeah, I think that's really good advice. Kathy, what was your impression?
I just really, at first, I was like, where is this going? And then all of a sudden, I could see it. I could see when you found the spot. And I loved how you work. I can see how this could work. Like just seeing this little snippet, I can see how this would really, over a period of time, allow you some space to really think about that physical space, the emotional space, the cognitive space. So it really brings a lot of things together. It really makes me excited to learn more about brain spotting. And as we close up our time together, I would just say this is really something I would like to know more about, and I would be interested in trying myself. So thank you, Melissa.
Yes, thank you for having me. And for anyone who might be a therapist and is interested in training, there is a phase 1 training coming to the Baltimore area in July. And if anyone is interested in trying brain spotting for themselves, you can um, Google for a brain spotting therapist in your area. That's one way to find a therapist who uses this modality.
That's perfect. We can put that information in the description below for viewers to get more information about. And I want to echo Kathy and thank you, Melissa, for your time and your energy and just that strong knowledge base you have about brain spotting that you really brought into our meeting today, which was really informative.
Anytime, I'm always happy to share about brain spotting.
Wonderful. Well, thank you so much, Melissa. It was wonderful to see you, and I'm just super excited to share the word about brain spotting with the community.
That sounds great.
All right. Well, you take
Thank you.
care. Thank you.
Bye.
Bye.
Bye.